Hi, and welcome to the Joint Replacement class. My name is Janet Dyroff, and I'm the patient educator for the Joint Replacement Center at Maine Medical. Today, we're going to talk about how to prepare for your joint replacement surgery. First of all, I'd like to say thank you for choosing Maine Medical, where we do over 1,700 total joint replacement surgeries each year, performing state-of-the-art procedures that lead to faster recovery. Our class goals for today are to answer as many of your questions as possible and to present the information in a language that is easy to understand. I'd like to encourage you to call if you have any further questions and make sure that you review the steps you'll need to know before your surgery. So what can you do to get ready? You can begin by reviewing the patient education guide that was given to you from your surgeon's office. Make sure you review and save your appointment sheet and call Maine Medical Partners for appointment changes if that should be necessary. They are at 207-781-1551. And there's more. Stay as active as possible as you're leading up to your surgery. Exercise if you've been instructed to do so by your surgeon. Eat and drink healthy food and fluids, and have a flu vaccine at least 3 weeks before your surgery. Limit or quit smoking because we do have smoke-free facilities here at Maine Medical. Be sure your diabetes is under control and stay informed and ask lots of questions. What else can you do? If you've been asked to have any medical clearances completed before your history and physical, that would be really helpful. Discuss any medication orders as well during your history and physical appointment. If you're given any instructions about medications, please follow them, especially before the surgery. And check with your insurance provider regarding any coverage questions about equipment or prescriptions. You'll need to have a walker, and this is a recommended walker from our rehabilitation services. If you're going to borrow a walker, please borrow it from someone who is close to your own height whenever possible. Walkers are adjustable to a point. Rehabilitation therapy can help with those adjustments. Wheels can be added or removed if necessary. And then also make sure that you have a cane for when you go home. Talking about home, let's think about ways you can prepare your home for the eventual arrival back there. Arrange for help at home. Some people or someone that can stay overnight for a few days. Someone to help with light errands. Maybe prepare meals or prepare them in advance if necessary. Preparing your home before surgery is going to greatly reduce your anxiety when you come home. It's also good to do a safety check. So remove any scatter rugs, electrical cords that you might need to tape down. Organize your bathroom and kitchen so that objects are easy to reach, and maybe create a tool belt of sorts to carry portable phones, covered cups, etc. Set up a recovery area in your home, a recliner or a couch, and you may decide that you want to sleep in a downstairs bedroom for a few days. That's all up to you, but not necessary. Things to bring to the hospital the day of surgery. Make sure you bring that front-wheeled walker. If you have sleep apnea, we ask that you bring your CPAP machine if you have one. Personal toiletries, toothbrush, toothpaste, comb, and then also glasses, hearing aid, and dentures. Make sure you have loose-fitting, comfortable clothes for each day that you're here in the hospital. Sweatpants, flannel pants, skirts, dresses, something that's comfortable that doesn't need to be pulled on over a dressing. Blue jeans usually aren't a good idea. Closed-toed shoes, please, if you would. No flip-flops or Crocs. And then have your insurance information and a photo ID with you so you can hand those in at admitting. The night before surgery, nothing to eat after midnight, including gum or mints. After midnight, you may have clear liquids as directed by the preoperative provider that you visited with at the Brighton Medical campus. Make sure you wash with Hibiclin soap, which was given to you during your history and physical appointment. And please make sure that you do not shave, use hair removal products, or write or mark on the surgical area um, that you're coming to have operated on. Gentlemen, you may shave your faces, and ladies, if you'd like to shave your legs, please do so at least a week out if you're having a knee replacement. On the day of surgery, we're going to ask you to shower again with the remaining Hibiclens soap. Take any medications as directed with a sip of water, and arrive at the main admitting office here at Maine Medical at the scheduled time. Please do not bring any of your medications from home to the hospital unless specifically instructed to do so by your preoperative provider from Brighton. From the admitting area, you will be escorted upstairs to the second floor of the L.L. Bean wing to our Surgery 2 unit, and you'll be admitted there into our pre- and post-anesthesia care unit, also known as PACU. You may bring 2 guests with you into that area before your surgery, and the nurses, when you arrive, will help you get ready. Please make sure you have a list of the day and time that you took any medications that are prescribed to you last. That will be important to share with the nursing staff. You'll have an opportunity to meet briefly with the anesthesia and your surgeon for any last-minute questions, and your surgery usually will take anywhere from 1 to 3 hours. Once your surgery is over, you will be waking up in the recovery room. Again, everyone's recovery time is slightly different. We always make an estimate of 1 to 3 hours. When you first start to wake up, you'll be attached to equipment to monitor your heart rate. You will be having oxygen to assist you with waking up. You will continue to have IV fluids where you will have antibiotics and pain management as needed. Also with postoperative care, you may have a drain coming from your incision. That's removed early the next morning. Your incision will be covered. And as soon as you are awake and alert and comfortable, the nurses will get a visitor to come in and greet you. Our goal is to help you keep comfortable after surgery. We teach you to describe your comfort level using a 0 to 10 scale. You will set a goal based on this 0 to 10 scale, which is acceptable to you. 0 will mean no pain or no discomfort, and 10 will be the most discomfort that you've ever had. Many patients find that 3 to 5 is an acceptable level of comfort. Each of you will have a different level of acceptance, and we will use your personal comfort goal as our guide. As soon as you're ready, you'll be transferred to inpatient care where your nurse will greet you. You may initially be drowsy. You will still have your IV, and that will be discontinued after you're drinking enough fluids. You'll be encouraged to eat a light meal when you are able. Your comfort will remain very important to us. You'll need to be doing exercises, and we want you to be comfortable. And when you're comfortable, you will also be better able to heal. In the first 24 hours, we will help you transition to medication by mouth, at which time you'll need to ask for your medication to maintain your comfort level. There will be a rehabilitation therapy schedule posted in your room on a whiteboard. You may have your first physical therapy session on the same day as your surgery, and you may walk with your nurse before you have a visit from rehabilitation therapy. Usually takes 30 to 45 minutes before your medication is on at therapeutic levels, so it's good for you to remember that when it comes to taking meds before your appointments. Medications, again, will keep you comfortable and ready to do those exercises. And I'd like to share it's the hospital policy that you please ask for help from staff before getting out of bed, even when you think you can get out alone. Patients may need to wear some compression stockings after their surgery. They help with circulation and prevent blood clots. Please wear them as instructed. Walking is another thing to help prevent any risks. And so, again, walking will help you with blood clots. You will also receive antibiotics for the first 24 hours. We encourage you that hand washing should be done by everyone entering your room, whether staff or family. So please remind people that there are hand washing stations all over the hospital and ask them to use it frequently. And then again, just a reminder, the policy is to call for help before getting out of bed. Other ways to help with comfort, relaxation and deep breathing, changing your position frequently, asking for ice packs, and ask your nurse for suggestions. As you prepare for discharge, your nurse will help you do that. She will review medications with you and discuss common side effects. Nurses work part of your team to provide you with care. A nurse care manager will also assess your needs before you go home. She will begin to help you formulate a discharge plan with input from rehabilitation, yourself, and your surgeon. Home therapies after discharge will be arranged for the care manager, and it's important for you to check with your insurance provider regarding any coverage so that you're able to have a conversation with the care manager once you're here. If you have any questions after today or after reading through your patient education guide, I'd like you to feel free to contact me here at Maine Medical. Again, my name is Janet Dyroff. My phone number is 662-6054. Email is jdyroff@mmc.org. We look forward to seeing you soon for a successful surgery. Thank you so much.